Hi, Dr. Hagmeyer here, and I regularly receive several emails from women in their late teens and 20s who suffer and are just in desperate need of help because of PCOS. And sadly, when it comes to treatment, I see one of two scenarios that really happens to many of these women. And these two scenarios really never address the cause of the problem, and neither one of them is really particularly successful. Scenario number one basically blocks a woman's hormone production. This approach can involve either birth control pills, androgen blockers, which are androgens are your male hormone. These are male hormone blockers, synthetic estrogens and progestins like oral contraceptives, or even drugs like Lupron or similar drugs that really just block or completely stop hormone production entirely. Now, the other approach is really prescribing drugs that are typically designed for type 2 diabetics, and these are drugs that reduce something called insulin resistance. These are going to be drugs like metformin, glucophage, Glumetza, and like I said earlier, both of these approaches that we just briefly spoke about really neglect the cause of the problem and really only set up young women for more problems later on in life. Now, when a woman suffers with PCOS, we're really referring to multiple cysts on the ovaries and then the problems that really go along with them. And those are things like a lack of ovulation, menstrual cycle irregularities, hirsutism, which is male facial hair or facial hair patterns, male pattern baldness, and of course, one of the things that affects so many women, their self-esteem as it relates to PCOS, is really, really bad acne. Now, all of these symptoms, when we really get down to it and really ask why, what they are all the result of is a metabolic and hormonal imbalance. And most of the time, if you take a natural approach like the one outlined on my website, you can drastically improve many of these areas of your health, and consequently, you can have so much better self-esteem, you can normalize your cycle, you can have better skin, you can stop hair loss, and ultimately, you can feel good again. Now, women with PCOS may also have varying degrees of insulin resistance, and with insulin resistance comes an increased incidence of type 2 diabetes, unfavorable lipid patterns, usually high triglycerides, and low bone density, which of course is a big concern for women as they start to age and get into their 40s and 50s and 60s. Now, if you were to look at a blood test of a woman with PCOS, what you're typically going to see is you're going to see higher than normal circulating androgens. These are going to be male hormones. These are going to be things like testosterone, DHEA, and DHT, dihydrotestosterone. Now, here's where the problem begins. When a woman doesn't ovulate due to PCOS, this causes just an entire disruption in the normal cyclical relationship of hormones that involve not only the ovaries, but also involve the brain. Now, so for all of you ladies that are watching this is not just a problem related to the ovaries and hormones, but a signaling problem between the brain and the body, okay? Very, very clear distinction that needs to be made here. What we're talking about here is an area of the brain called the hypothalamus, the pituitary, and the ovaries. So it's called the hypothalamic pituitary ovarian axis, or the HPO axis, okay? This is why I'm so adamantly against these patches, intrauterine devices, pills that not only stop a woman's cycle, but also introduce foreign synthetic chemicals or hormones into a body that they have never seen before. How can you bring about balance to the body by stopping a natural rhythmic process or by introducing foreign chemicals into the body? These hormones, these foreign hormones, they don't act or behave the same way that your body's natural hormones behave. Let me explain to you what happens or what should happen during a normal menstrual cycle. So this is going to be a little bit technical, but I think many of you that are just struggling to find answers, you will appreciate this. The brain, and including the pituitary gland, the ovaries, and the uterus, obviously follow this normal sequence of events every month. And it's this sequence that either helps your body prepare for pregnancy or not for pregnancy. It's that simple. The menses phase, obviously, is the phase which typically lasts between days 1 to day 5. And this is the time when the lining of the uterus is actually shed out through the vagina, and if pregnancy has not occurred. Now, most women during this period may bleed for 3 to 5 days. And the next phase is what's called the follicular phase. This is the phase that typically lasts between 6 and 14 days. And during this time, the level of the hormone estrogen continues to rise. And it's the rising levels of estrogen which causes the lining of the uterus, called the endometrium, to grow, thicken, become more vascular, obviously just more blood supply to the tissue to support pregnancy. In addition, there's another hormone called FSH, or follicle stimulating hormone. And just like the name indicates, it's going to stimulate the follicle to grow. During days 10 to 14, only one of these follicles is really developing into a fully mature egg or ovum. The next stage is what we call ovulation. During this phase, ovulation, which is really roughly in a 28-day cycle, this is day 14, and it's during this day that ovulation causes a sudden increase in a hormone made in the brain called luteinizing hormone to be released. Okay, as luteinizing hormone is released from the pituitary gland, again, that area in the brain, this causes the ovary to release its egg. And this is what we call ovulation. Now, fertilization doesn't occur during ovulation. The ovary stops this increased production of estrogen and progesterone. And then what happens is there's a sudden fall in the concentration of these hormones, and it's the drop of these hormones that causes the shedding of the blood-rich uterine lining. This is now bleeding occurs, and now we have the menstruation process. In response to these low hormones, estrogen and progesterone levels start to rise again. The brain starts to see this increasing rise, and the cycle starts all over again. So that's the overview of what happens during a normal woman's cycle. For many women with PCOS, because of hormonal changes, many women have irregular or non-existent periods. And this can be very, very dangerous to long-term health. Okay, so I want to talk to you about what happens during the menstrual cycle of a woman that has PCOS. Okay, multiple small follicles called cysts develop in the ovary, but due to a variety of hormonal imbalances, the follicles never grow to what's called the pre-ovulatory size. And that's a very critical point that I want you to understand. Essentially, they're unable to grow to the size that would trigger a surge in progesterone. And remember this, if you do not have a surge of progesterone, you don't ovulate, which in turn causes more of a hormone called luteinizing hormone to be released from the brain. And this is why we see, if we measure those luteinizing hormone levels in a woman with PCOS, we're going to see those levels elevated. Okay? So again, without proper LH levels, luteinizing hormone levels, you can't release the egg and you don't have ovulation. Huge, huge point. If you don't ovulate, you become more and more estrogen dominant. You become more and more progesterone deficient with each cycle. And here is where we begin to see all the signs of estrogen dominance. And I've done a video that kind of goes through those symptoms. I've gone through another video that talks about androgen dominance. What are the signs and symptoms of having too much male hormones in your body? But that actually brings us to the next aspect of PCOS, and that's the common aspect that's talked quite a bit about, and that's the androgen connection. Now again, androgens are these male hormones, and they often are also increased in women with PCOS for several reasons. Number one is that estrogen is a fat-storing hormone. So the more estrogen your body begins to make, the more fat you begin to deposit. High levels of these hormones, called the luteinizing hormone, will actually increase the amount of androgens, and with those high levels of androgens comes higher levels of insulin. This is a major stressor to the body, and so now these glands called your adrenal glands are recruited into the picture, and they begin converting estrogen into testosterone. And here again is where we see more androgen dominance. We start to see again that hair loss, we see acne, we see a loss of ovulation, we see maybe possibly just a complete loss of the menstrual cycle. And so again, this is the connection that PCOS has to the adrenal glands, which again is why these adrenals need to be properly tested. Now, like I said, I know in today's video, was a little bit long. I know it was a little technical, but I hope it helps you understand just more about PCOS. I want you to appreciate the complex nature of this and realize why taking pills, patches, shots, drugs aimed at just simply lowering blood sugar, stopping hormones, or introducing unnatural foreign hormones can't really address all of the complexities that often make this a much bigger mess. You do need to work with a holistic practitioner who is going to investigate the many causes of your PCOS, who understands the many interrelationships that exist with PCOS. And so if you're suffering with PCOS, polycystic ovarian syndrome, please call our office, okay? Reach out to us. Let us give you the answers as to why you feel the way that you do. Let us see if there's more that can be done for you, okay? We want you to get back to enjoying life and just experiencing life to the fullest, okay? So I hope you enjoyed today's video. Until next time, take care.